Phlebotomy Certification Exam Fasting Specimens Review. Question 1. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best in the outpatient clinic during a review? Option A. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Option B. Tell the patient not to mention the meal. Option C. Cancel every test without notifying anyone. Option D. Draw the specimen and write fasting on the label. The correct answer is option A. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Hiding the meal prevents proper interpretation of results. Canceling without communication may disrupt care and exceed the phlebotomist's role. Marking the specimen as fasting would be inaccurate documentation. Question 2. Why is fasting status important before some chemistry tests in the hospital unit during morning rounds during a mock exam? Option A. Fasting makes needles sterile. Option B. Food intake can alter analytes such as glucose or lipids. Option C. Fasting eliminates the need for tube mixing. Option D. Food changes the patient's legal name. The correct answer is option B. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Sterility comes from equipment and technique, not fasting. Additive tubes still require proper mixing regardless of fasting status. Food intake does not affect patient identity. Question 3. For a troponin collection, which instruction is commonly given for a fasting blood test unless policy says otherwise in the urgent care laboratory during a skills check? Option A. Chew gum with sugar during the fast. Option B. Eat a small snack because it will not matter. Option C. Avoid food and most beverages except water for the required fasting period. Option D. Drink sugary beverages before arrival. The correct answer is option C. Avoid food and most beverages except water for the required fasting period. Fasting helps standardize results for tests affected by recent food intake. Sugared gum can break the fast for some testing instructions. A snack can invalidate fasting status for tests that require it. Sugary beverages can alter glucose and other chemistry results. Question 4. A fasting patient asks whether water is usually allowed. How should the phlebotomist respond? Option A. Encourage juice because it keeps veins full. Option B. Say hydration never affects blood draws. Option C. Tell the patient water always ruins every test. Option D. Explain that water is commonly allowed unless the specific instructions or provider say otherwise. The correct answer is option D. Explain that water is commonly allowed unless the specific instructions or provider say otherwise. Water is often permitted during fasting and can support hydration, but the exact instruction depends on the ordered test and policy. Juice contains sugar and can affect fasting analytes. Hydration can affect vein access, so it is not irrelevant. Water does not automatically ruin fasting laboratory tests. Question 5. Why is the site of a prior mastectomy often avoided for venipuncture in the long-term care unit during a scenario? Option A. Lymphatic changes can increase risk for swelling, infection, or complications. Option B. The skin cannot be cleaned. Option C. All specimens from that side clot immediately. Option D. The veins always contain arterial blood. The correct answer is option A. Lymphatic changes can increase risk for swelling, infection, or complications. Mastectomy with lymph node involvement can affect lymph drainage, so the opposite arm is preferred when possible. The issue is not an inability to cleanse skin. Specimens do not automatically clot because of collection side. Venous blood does not become arterial because of mastectomy history. Question 6. When N4 is running in one arm, which collection choice is usually preferred in the mobile collection site during a competency review? Option A. Collect directly through the foretubing without authorization. Option B. Use the opposite arm when available and follow facility policy. Option C. Ignore the fore because additives prevent contamination. Option D. Draw above the fore site while fluid is running. The correct answer is option B. Use the opposite arm when available and follow facility policy. Using the opposite arm helps prevent dilution or contamination from fore fluids. Line draws require authorization and specific procedure. Tube additives do not correct fore fluid contamination. Drawing above a running fore can contaminate or dilute the specimen. Question 7. In a routine phlebotomy scenario, which finding makes a venipuncture site a poor choice in the emergency department bay during a final review? Option A. Clean intact skin over an antecubital vein. Option B. A site that allows safe patient positioning. Option C. Edema, burns, scarring, or signs of infection at the site. Option D. A vein that is palpable and resilient. The correct answer is option C. Edema, burns, scarring, or signs of infection at the site. Compromised tissue can affect specimen quality and increase patient risk, so another site should be chosen. Clean intact skin supports safe site preparation. Safe positioning is desirable for venipuncture. A palpable resilient vein is generally a favorable finding. Question 8. A swelling begins forming around the puncture site during collection. What should the phlebotomist suspect in the physician office lab during a study session? Option A. Successful fasting status. Option B. Normal clot retraction in the vein. Option C. Proper tube mixing. Option D. Hematoma formation. The correct answer is option D. Hematoma formation. Swelling during a draw suggests blood is leaking into surrounding tissue, forming a hematoma. Fasting status cannot be determined by puncture site swelling. Clot retraction is a laboratory process, not a normal event around an active needle site. Tube mixing happens after collection and does not cause local swelling. Question 9. If a hematoma starts to develop during venipuncture, which action is appropriate in the community health screening event during a structured exam prep drill? Option A. Release the tourniquet, remove the needle, and apply pressure. Option B. Massage the swollen area vigorously. Option C. Ask the patient to bend the elbow tightly. Option D. Continue filling all ordered tubes. The correct answer is option A. Release the tourniquet, remove the needle, and apply pressure. Stopping the draw and applying pressure limits further bleeding into the tissue. Vigorous massage can worsen bruising and tissue injury. Bending the elbow can increase bruising and does not provide focused pressure. Continuing the draw can enlarge the hematoma. Question 10. A patient becomes pale and says they feel dizzy during a blood draw. Which response is safest in the preoperative testing area during a clinical simulation? Option A. Leave the needle in while getting more tubes. Option B. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Option C. Give the patient food before removing the needle. Option D. Ask the patient to stand up and walk it off. The correct answer is option B. Stop the draw, remove the needle, lower the patient's head or position safely, and seek help as needed. Dizziness may signal syncope, so the priority is preventing injury and stopping the procedure safely. Leaving the needle in place while symptoms progress increases injury risk. Food is not the first action while a needle is still in the arm. Standing can lead to a fall. Question 11. After drawing a patient who takes anticoagulants, what post-puncture step is especially important in the oncology infusion center during a review? Option A. Ask the patient to bend the elbow sharply. Option B. Use the same bandage time for every patient without checking. Option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Option D. Skip pressure to avoid bruising. The correct answer is option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. Bending the elbow can promote bruising instead of controlled pressure. A fixed time without checking may miss ongoing bleeding. Skipping pressure increases bleeding risk. Question 12. To protect patient safety, which action helps prevent a hematoma after removing the needle in the dialysis-adjacent clinic during a mock exam? Option A. Rub the puncture site to spread the blood. Option B. Remove the needle before releasing the tourniquet every time. Option C. Have the patient bend the elbow tightly. Option D. Apply clean gauze with firm pressure while the arm remains straight. The correct answer is option D. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. Rubbing can disrupt clot formation and worsen bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Bending the elbow may increase leakage into tissue. Question 13. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider in the student skills lab during a skills check? Option A. Possible arterial puncture. Option B. Tube additive carryover. Option C. Normal capillary refill. Option D. Proper venous flow. The correct answer is option A. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Typical venous flow is darker and not pulsatile. Question 14. When preparing for collection, which tube is collected first when blood cultures are ordered with other venipuncture tubes in the occupational health clinic during a practice drill? Option A. Gray fluoride tube. Option B. Blood culture bottles or sterile culture tube. Option C. Serum separator tube. Option D. Lavender EDTA tube. The correct answer is option B. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. EDTA tubes are collected later to prevent additive carryover. Question 15. In the standard venipuncture order of draw, which tube usually follows blood cultures in the blood collection station during a scenario? Option A. Gray fluoride tube. Option B. Royal blue tube for every test. Option C. Light blue sodium citrate tube. Option D. Lavender EDTA tube. The correct answer is option C. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. EDTA is collected later because it can interfere with coagulation and chemistry tests. Question 16. Before proceeding with the draw, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes in the outpatient clinic during a competency review? Option A. Gray, lavender, green, serum, light blue, blood cultures. Option B. Serum, lavender, blood cultures, gray, light blue, green. Option C. Lavender, gray, green, serum, light blue, blood cultures. Option D. Blood cultures, light blue, serum, green, lavender, gray. The correct answer is option D. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Starting with lavender risks EDTA contamination of later tubes. Question 17. Why does order of draw matter during evacuated tube collection in the hospital unit during morning rounds during a final review? Option A. It helps prevent additive carryover from altering later specimens. Option B. It eliminates the need to mix tubes. Option C. It determines the patient's fasting status. Option D. It makes patient identification optional. The correct answer is option A. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Patient identification is required regardless of tube order. Question 18. During capillary puncture, which specimen type is generally collected first when ordered in the urgent care laboratory during a study session? Option A. Gray top microtube. Option B. Blood gas specimen. Option C. Non-additive tube after all others. Option D. Serum specimen. The correct answer is option B. Blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Serum is not first when blood gases are ordered. Question 19. For a thyroid panel collection, which capillary collection order is commonly used after blood gases when EDTA testing is ordered? Option A. Gray microtube first even when blood gases are needed. Option B. Any order because capillary tubes have no additives. Option C. EDTA microtube before other additive and serum microtubes. Option D. Serum microtube before EDTA for every draw. The correct answer is option C. EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Blood gases are more time-sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Serum first collection can allow clotting before the EDTA specimen is filled. Question 20. To protect patient safety, which tube is most appropriate for a routine CBC in the long-term care unit during a clinical simulation? Option A. Gray sodium fluoride tube. Option B. Red no additive tube. Option C. Light blue sodium citrate tube. Option D. Lavender top tube containing EDTA. The correct answer is option D. Lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Citrate is used mainly for coagulation testing. Question 21. After reviewing the order, which additive is found in a light blue tube used for patient and APTT testing in the mobile collection site during a review? Option A. Sodium citrate. Option B. Sodium fluoride with potassium oxalate. Option C. Lithium heparin. Option D. EDTA. The correct answer is option A. Sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. EDTA is used mainly for hematology and can interfere with coagulation testing. Question 22. When preparing for collection, which tube is commonly selected for many serum chemistry tests when gel separation is desired in the emergency department bay during a mock exam? Option A. Light blue citrate tube. Option B. Serum separator tube with clot activator and gel. Option C, gray fluoride tube only. Option D, lavender EDTA tube. The correct answer is option B, serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. EDTA plasma is not serum and can interfere with some chemistry tests. Question 23. In a routine phlebotomy scenario, which tube is commonly associated with heparinized plasma chemistry testing in the physician office lab during a skills check? Option A, light blue top tube. Option B, pink top tube. Option C, green top tube. Option D, lavender top tube. The correct answer is option C, green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Lavender tubes contain EDTA for hematology. Question 24. Before proceeding with the draw, which tube is most commonly used for glucose preservation when testing may be delayed in the community health screening event during a practice drill? Option A, light blue citrate tube. Option B, blood culture bottle. Option C, plain red tube only. Option D, gray top tube with sodium fluoride and an anticoagulant. The correct answer is option D, gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. A plain red tube does not contain glycolysis inhibitor. Question 25. During a scenario, which tube is commonly used for blood bank testing such as type and screen in the preoperative testing area during a scenario? Option A, pink top EDTA tube. Option B, light blue citrate tube. Option C, green heparin tube for every blood bank test. Option D, gray top fluoride tube. The correct answer is option A, pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Gray tubes are associated with glucose or lactate preservation. Question 26. In the Oncology Infusion Center, which tube is generally collected for a blood culture specimen in the Oncology Infusion Center during a competency review? Option A, gray fluoride tube. Option B, sterile blood culture bottle or SBS containing culture tube according to policy. Option C, SST after clotting. Option D, lavender EDTA tube only. The correct answer is option B, sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. A lavender tube is not designed as the primary blood culture container. Question 27. Why must a light blue citrate tube be filled to the proper level while preparing a patient/INR specimen in the dialysis adjacent clinic? Option A, EDTA needs extra room to mix. Option B, serum cannot clot unless the tube is full. Option C, the blood to anticoagulant ratio must be correct for coagulation results. Option D, the tube color changes if underfilled. The correct answer is option C, the blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. EDTA is not the additive in a light blue citrate tube. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Tube color does not change to warn of underfilling. Question 28. After collecting an additive tube, how should it usually be mixed while preparing a basic metabolic panel specimen in the student skills lab? Option A. Leave it unmixed until centrifugation. Option B. Open the stopper and stir with a wooden applicator. Option C. Shake it hard until bubbles appear. Option D. Gently invert the tube the recommended number of times. The correct answer is option D. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Failure to mix can allow clotting or poor additive action. Opening a tube risks exposure, contamination, and specimen loss. Vigorous shaking can cause hemolysis. Question 29. After reviewing the order, which problem can occur if a lavender EDTA tube is not mixed soon after filling in the occupational health clinic during a structured exam prep drill? Option A. Microclots may form and make hematology results unreliable. Option B. The specimen turns into serum. Option C. The sodium citrate ratio improves. Option D. The tube becomes sterile for culture. The correct answer is option A. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Sodium citrate is not the additive in a lavender EDTA tube. Mixing does not create sterility for culture testing. Question 30. When preparing for collection, which practice helps reduce hemolysis during a routine fasting glucose collection in the blood collection station during a clinical simulation? Option A. Shake additive tubes vigorously. Option B. Use appropriate needle size and gently invert tubes instead of shaking them. Option C. Pull back a syringe plunger as hard as possible. Option D. Force blood rapidly through a small needle. The correct answer is option B. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Vigorous shaking is a common cause of hemolysis. Excessive syringe force can rupture cells and compromise results. Forcing blood through a small needle can damage cells. Question 31. In a routine phlebotomy scenario, which laboratory result is especially affected by hemolysis because red cells release intracellular contents in the outpatient clinic during a review? Option A. Tube expiration date is extended. Option B. Tourniquet pressure becomes lower. Option C. Potassium may be falsely increased. Option D. Patient date of birth becomes invalid. The correct answer is option C. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. A specimen problem cannot extend tube expiration. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Patient demographics are not changed by cell rupture. Question 32. When using a syringe for blood transfer, which method best protects specimen quality while preparing a lipid panel specimen in the hospital unit during morning rounds? Option A. Squirt blood through the needle into each tube. Option B. Shake each tube hard to remove clots. Option C. Remove the tube stopper and push blood in forcefully. Option D. Use a safety transfer device and allow blood to flow gently into tubes. The correct answer is option D. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Pushing blood through a needle can cause hemolysis and Sharp's injury. Shaking tubes can rupture cells and worsen specimen quality. Removing stoppers increases exposure and contamination risk. Question 33. Why should alcohol be allowed to dry before puncture while preparing a troponin specimen in the urgent care laboratory? Option A, wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Option B, wet alcohol improves vein anchoring. Option C, alcohol drying replaces tourniquet use. Option D, dry alcohol makes the tube additive stronger. The correct answer is option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Vein anchoring depends on hand technique, not wet alcohol. Tourniquet use is a separate step for vein distension. Drying does not change the chemical strength of tube additives. Question 34. In the pediatric clinic, which specimen often requires protection from light after collection in the pediatric clinic during a practice drill? Option A, routine sodium citrate coagulation tube. Option B, bilirubin specimen. Option C, blood culture bottle during incubation. Option D, CBC specimen for platelet count. The correct answer is option B. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Question 35. For a hemoglobin A1C collection, which specimen commonly requires rapid transport on ice or chilled handling according to policy in the long-term care unit during a scenario? Option A, serum separator tube for a lipid panel after clotting only. Option B, blood culture bottle placed in the freezer. Option C, ammonia specimen. Option D, routine CBC kept for the next day. The correct answer is option C. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Blood culture bottles should not be frozen because organisms must remain viable for detection. A routine CBC should not simply be held for the next day without stability guidance. Question 36. To protect patient safety, which action best maintains specimen integrity during transport to the laboratory in the mobile collection site during a competency review? Option A, centrifuge every tube immediately regardless of type. Option B, place all blood specimens in direct sunlight. Option C, store every specimen at room temperature overnight. Option D, follow required time, temperature, light, and handling instructions for the ordered test. The correct answer is option D. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Some tubes should not be centrifuged immediately or at all before required steps. Sunlight can degrade light-sensitive analytes and warm specimens. Overnight room temperature storage can make many specimens unacceptable. Question 37. If a specimen must be transported cold, which approach is appropriate while preparing a therapeutic drug level specimen in the emergency department bay? Option A, place the specimen in the approved cooling method without direct water contamination. Option B, hold it in a bare hand to keep it visible. Option C, place it near a heater until pickup. Option D, submerge the tube in loose ice water. The correct answer is option A. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. Holding the specimen warms it and defeats the cold requirement. A heater can destabilize temperature-sensitive analytes. Loose ice water can damage labels and create contamination issues. Question 38. When preparing for collection, which situation is a common reason for specimen rejection in the physician office lab during a study session? Option A, patient stated date of birth. Option B, wrong tube type or insufficient specimen volume. Option C, tube was labeled at the bedside. Option D, collector wore gloves. The correct answer is option B. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Patient-stated identifiers support accurate identification. Bedside labeling is the correct practice. Wearing gloves is expected when blood exposure is possible. Question 39. Why should tube expiration dates be checked before collection while preparing a ammonia specimen in the community health screening event? Option A, expired tubes prevent hemolysis in every case. Option B, expired tubes are required for coagulation testing. Option C, expired tubes may have inadequate vacuum or unreliable additive performance. Option D, expired tubes identify patients faster. The correct answer is option C. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. No expired tube can guarantee hemolysis prevention. Coagulation testing requires properly filled, unexpired citrate tubes. Expiration dates do not help verify identity. Question 40. For a medication trough level, when is the specimen usually collected in the preoperative testing area during a clinical simulation? Option A. At any random time during the day. Option B. Only after the medication is discontinued for a week. Option C, immediately after the medication is swallowed. Option D, immediately before the next scheduled dose. The correct answer is option D. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Random timing can make therapeutic drug results difficult to interpret. Stopping medication for a week is not the routine way to collect a trough. Immediately after dosing reflects absorption or peak timing, not trough. Question 41. During a glucose tolerance test, why must collection times be followed carefully in the Oncology Infusion Center during a review? Option A, timed results show how the body responds to a measured glucose dose. Option B, timing only matters after the last tube. Option C. The patient should eat between timed draws to stay comfortable. Option D. Any time is acceptable if the tubes are gray. The correct answer is option A. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Every scheduled interval matters for interpretation. Eating during the test can invalidate the glucose response pattern. Tube type does not remove the need for precise timing. Question 42. In the dialysis adjacent clinic, which documentation is especially important for a timed specimen? Option A. Only the patient's room number. Option B, exact collection time recorded on the label or requisition according to policy. Option C. A note saying collected sometime today. Option D. The phlebotomist's favorite tube brand. The correct answer is option B. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Room number is not a valid substitute for collection time. Vague timing can make the specimen clinically unreliable. Tube brand does not communicate timing. Question 43. Before collecting blood cultures, why is careful skin antisepsis critical in the student skills lab during a skills check? Option A. It eliminates the need for sterile bottles. Option B. It changes venous blood into arterial blood. Option C. It reduces contamination that could cause a false positive culture. Option D. It makes EDTA tubes clot faster. The correct answer is option C. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. Sterile collection containers are still required. Skin antisepsis does not change the type of blood collected. EDTA clotting is unrelated to culture site preparation. Question 44. When collecting blood cultures with other tubes, which priority is most important in the occupational health clinic during a practice drill? Option A. Touch the bottle tops after cleaning to confirm dryness. Option B. Use a non-sterile transfer cup. Option C. Collect cultures after gray tubes. Option D. Maintain sterility and collect cultures before non-sterile tubes. The correct answer is option D. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. Touching clean tops can recontaminate them. A non-sterile transfer process defeats the purpose of sterile collection. Collecting cultures after other tubes increases contamination risk. Question 45. If using a winged set for blood cultures, why is bottle order guided by facility policy in the blood collection station during a scenario? Option A. Air in the tubing can affect which bottle should be filled first. Option B. The order prevents the need to clean the site. Option C. The order makes the needle reusable. Option D. The order determines the patient's identity. The correct answer is option A. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Skin and bottle antisepsis are still required. Needles are single-use and cannot be reused. Bottle order does not verify patient identity. Question 46. For a legal blood alcohol collection, which requirement is especially important in the outpatient clinic during a competency review? Option A. Leave the specimen unlabeled until court. Option B. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Option C. Let the patient carry the open tube to the lab. Option D. Use alcohol swabs for every blood alcohol specimen. The correct answer is option B. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Unlabeled legal specimens break traceability. Allowing the patient to carry an open specimen compromises custody and security. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Question 47. In a routine phlebotomy scenario, which action best supports chain of custody for a drug screen specimen in the hospital unit during morning rounds during a final review? Option A. Store the specimen in an unlocked public area. Option B. Discard the seal after collection. Option C. Document each person who handles the specimen from collection to transfer. Option D. Use only verbal handoff with no signatures. The correct answer is option C. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. Unsecured storage can compromise specimen integrity. A broken or discarded seal weakens evidence of tamper control. Verbal handoff alone does not create a traceable legal record. Question 48. Why are tamper-evident seals used on forensic or workplace testing specimens in the urgent care laboratory during a study session? Option A. They make refrigeration unnecessary for all tests. Option B. They prevent the need for a requisition. Option C. They replace patient consent. Option D. They help show whether the specimen was opened or altered after collection. The correct answer is option D. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. Temperature requirements still depend on the test. A requisition or custody form is still needed for proper processing. A seal does not replace required consent or authorization. Question 49. For an infant heel stick, which area is safest for puncture in the pediatric clinic during a structured exam prep drill? Option A, medial or lateral plantar surface of the heel. Option B, center of the arch. Option C, tip of the great toe. Option D, posterior curvature of the heel. The correct answer is option A. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The arch is not an approved heel stick site. The great toe is not the standard infant heel stick site. The posterior curvature increases risk of bone injury. Question 50. Why should an infant heel puncture not be too deep in the long-term care unit during a clinical simulation? Option A, depth determines the tube color. Option B, excessive depth can injure bone or deeper tissue. Option C. A deep puncture replaces the need for warming. Option D. A deeper puncture always prevents hemolysis. The correct answer is option B. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Tube color is selected by test requirements, not puncture depth. Warming is a separate step used to improve blood flow when appropriate. Deeper puncture can increase injury and does not guarantee specimen quality. Question 51. For a electrolyte panel collection, which finger is generally preferred for adult capillary puncture? Option A, index fingertip in all adults. Option B, little finger near the bone. Option C, middle or ring finger on the palmar surface near the side of the fingertip. Option D, thumb pad for every test. The correct answer is option C. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The index finger is often more sensitive and calloused. The little finger has less tissue over bone and higher injury risk. The thumb may be more calloused and is not the routine first choice. Question 52. After a finger puncture, why is the first drop of blood commonly wiped away in the emergency department bay during a mock exam? Option A. It proves the patient is fasting. Option B. It activates the tube vacuum. Option C. It contains only white blood cells. Option D. It may contain tissue fluid or contaminants that can affect the specimen. The correct answer is option D. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. Fasting status cannot be determined from the first drop. Capillary collection does not depend on evacuated tube vacuum at the puncture site. The first drop is not composed only of white blood cells. Question 53. How can warming a capillary puncture site help collection in the physician office lab during a skills check? Option A. It increases local blood flow when used safely. Option B. It removes the need to identify the patient. Option C. It makes every specimen suitable for culture. Option D. It sterilizes the skin completely. The correct answer is option A. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Patient identification is still mandatory. Capillary specimens are not automatically suitable for blood culture collection. Warming does not sterilize skin. Question 54. Why should excessive squeezing or milking be avoided during capillary collection in the community health screening event during a practice drill? Option A. It makes EDTA unnecessary. Option B. It can dilute the specimen with tissue fluid and cause hemolysis. Option C. It prevents clotting in serum tubes. Option D. It improves all glucose results. The correct answer is option B. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. EDTA is still needed when an EDTA microtube is required. Serum tubes are intended to clot and are not protected by squeezing. Glucose results can be affected by poor specimen quality rather than improved. Question 55. When is dermal puncture commonly preferred over venipuncture in the preoperative testing area during a scenario? Option A. For all coagulation studies regardless of policy. Option B. Whenever patient identification is incomplete. Option C. For some infants, small volume tests, or patients with difficult veins when appropriate. Option D. For every blood culture set. The correct answer is option C. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Coagulation testing has strict specimen requirements and is not automatically dermal. Incomplete identification must be resolved before any collection method. Blood cultures usually require sterile venipuncture collection and adequate volume. Question 56. A child begins to pull away during a draw. Which action supports safety in the Oncology Infusion Center during a competency review? Option A. Scold the child until they stop. Option B. Ask another child to hold the arm. Option C. Continue while the arm is moving. Option D. Pause if needed and obtain appropriate assistance for safe positioning according to policy. The correct answer is option D. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Scolding is not therapeutic and can escalate fear. Another child is not appropriate assistance for a procedure. Continuing while the arm moves increases injury risk. Question 57. During a final review, which explanation is best for a young child before a finger stick in the dialysis adjacent clinic during a final review? Option A. Use simple honest words such as a quick pinch and explain what they can do to help. Option B. Use detailed adult medical terminology. Option C. Promise a toy only if they do not cry. Option D. Tell the child nothing will happen. The correct answer is option A. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Complex terminology can confuse or frighten a young child. Tying a reward to not crying can shame a normal fear response. Saying nothing will happen is misleading. Question 58. For an older adult with fragile veins, which technique is most appropriate in the student skills lab during a study session? Option A. Use the largest needle available. Option B. Use gentle anchoring and consider a smaller needle or controlled collection device. Option C. Leave the tourniquet on for several minutes. Option D. Slap the site hard to make veins appear. The correct answer is option B. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. A large needle can worsen trauma. Prolonged tourniquet time increases hemoconcentration and bruising risk. Slapping can injure delicate skin and is unprofessional. Question 59. Why should adhesive bandages be used carefully on some older adults in the occupational health clinic during a structured exam prep drill? Option A. Older adults never need pressure after draws. Option B. Bandages prevent all anticoagulant bleeding. Option C. Fragile skin can tear when adhesive is removed. Option D. Adhesive changes the blood type. The correct answer is option C. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. Older adults still need pressure until bleeding stops. A bandage does not eliminate bleeding risk, especially with anticoagulants. Adhesive has no effect on blood type. Question 60. Before assembling equipment for a fasting glucose draw, which item should be checked in the blood collection station during a clinical simulation? Option A. The patient's favorite beverage. Option B. The brand of wall clock in the room. Option C. Only the color of the chair. Option D. Tube type, expiration date, needle safety device, and requisition requirements. The correct answer is option D. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. Favorite beverage is not part of collection equipment verification. The wall clock brand does not confirm correct supplies or orders. Chair color has no role in specimen acceptability. Question 61. After reviewing the order, which sequence is safest after blood has entered the final tube in the outpatient clinic during a review? Option A. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. Option B. Activate safety device before removing the needle from the arm. Option C. Remove the needle and recap it before pressure. Option D. Withdraw needle with tourniquet tight and no gauze ready. The correct answer is option A. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Recapping a contaminated needle creates sharp's injury risk. Withdrawing with the tourniquet tight can increase bleeding and bruising. Question 62. When preparing for collection, which action should occur before leaving the patient after venipuncture in the hospital unit during morning rounds during a mock exam? Option A. Tell the patient to remove the bandage immediately. Option B. Confirm bleeding has stopped and provide appropriate post-draw instructions. Option C. Dispose of sharps after walking to another room. Option D. Leave while blood is still oozing. The correct answer is option B. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Immediate bandage removal can restart bleeding. Sharps must be disposed of promptly in the collection area. Leaving active bleeding unattended is unsafe. Question 63. Why is patient positioning important before venipuncture in the urgent care laboratory during a skills check? Option A. It changes EDTA into citrate. Option B. It allows the needle to be reused safely. Option C. It reduces the risk of falls or injury if the patient becomes dizzy. Option D. It makes labeling unnecessary. The correct answer is option C. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Body position does not change tube additives. Needles are single-use and cannot be reused. Proper positioning does not replace specimen labeling. Question 64. Before proceeding with the draw, which patient instruction is appropriate after a routine venipuncture in the pediatric clinic during a practice drill? Option A. Remove the bandage while still bleeding. Option B. Bend the elbow tightly for 10 minutes. Option C. Scratch the site if it feels itchy. Option D. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. The correct answer is option D. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Removing a bandage during bleeding can restart or worsen bleeding. Bending the elbow tightly can increase bruising. Scratching can disrupt the site and introduce contamination. Question 65. During a scenario, which laboratory department commonly performs CBC testing in the long-term care unit during a scenario? Option A. Hematology. Option B. Blood bank only. Option C. Histology only. Option D, microbiology only. The correct answer is option A, hematology. Hematology evaluates blood cells and commonly performs CBC testing. Blood bank focuses on compatibility and transfusion-related testing. Histology focuses on tissue specimens rather than routine CBC testing. Microbiology focuses on organisms and cultures. Question 66. In the mobile collection site, which department usually performs patient and APTT coagulation testing? Option A, microbiology culture bench only. Option B, coagulation or hematology coagulation section. Option C, cytology screening only. Option D, urinalysis only. The correct answer is option B, coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Microbiology culture benches identify organisms rather than routine clotting times. Cytology examines cells for diagnostic changes, not standard coagulation studies. Urinalysis focuses on urine specimens. Question 67. For a therapeutic drug level collection, which department is most associated with blood cultures? Option A, histology tissue processing. Option B, chemistry electrolyte analysis only. Option C, microbiology. Option D, blood bank compatibility only. The correct answer is option C, microbiology. Microbiology processes cultures to detect and identify microorganisms. Histology processes tissue rather than blood culture bottles. Chemistry analyzes chemical constituents and is not the main culture department. Blood bank testing focuses on transfusion compatibility. Question 68. To protect patient safety, which department commonly performs type and screen testing in the physician office lab during a study session? Option A, chemistry only. Option B, parasitology stool testing only. Option C, microbiology only. Option D, blood bank or transfusion services. The correct answer is option D, blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Chemistry focuses on analytes such as glucose and electrolytes. Parasitology stool testing does not perform transfusion compatibility testing. Microbiology focuses on infectious organisms. Question 69. After reviewing the order, which department commonly analyzes electrolytes such as sodium and potassium in the community health screening event during a structured exam prep drill? Option A, chemistry. Option B, blood bank compatibility bench. Option C, cytogenetics only. Option D, histology. The correct answer is option A, chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Blood bank compatibility testing is not the routine electrolyte section. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Histology focuses on tissues. Question 70. When preparing for collection, which practice is part of phlebotomy quality assurance in the preoperative testing area during a clinical simulation? Option A, changing tube labels after results are reported. Option B, tracking specimen errors and using corrective action to prevent recurrence. Option C, skipping competency checks for experienced staff. Option D, ignoring mislabeled specimens if the patient is well known. The correct answer is option B, tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Changing labels after reporting hides errors and compromises traceability. Competency checks help maintain consistent safe practice for all staff. Familiarity with a patient does not make a mislabeled specimen acceptable. Question 71. Why are competency assessments important for phlebotomists in the Oncology Infusion Center during a review? Option A, They allow staff to ignore order of draw. Option B. They are only for patients who complain. Option C. They verify that staff can perform required skills safely and consistently. Option D. They replace all written procedures. The correct answer is option C. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Order of draw remains important regardless of competency status. Competency is a proactive quality process, not only a reaction to complaints. Written procedures are still needed as standards for practice. Question 72. Before proceeding with the draw, which error should be reported through the facility's quality process in the dialysis adjacent clinic during a mock exam? Option A. A tube is mixed according to instructions. Option B. A needle safety device is activated after use. Option C. A patient correctly states their date of birth. Option D. A specimen collected in the wrong tube type. The correct answer is option D. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Proper tube mixing supports quality. Activating a safety device after use is the intended safety behavior. Correct identity confirmation is expected practice, not an error. Question 73. During a skills check, which activity is commonly associated with CLIA waived point of care testing in the student skills lab during a skills check? Option A. Following manufacturer instructions and documenting quality control for a simple approved test. Option B. Reporting results without controls when controls are required. Option C. Using expired test strips because they look normal. Option D. Changing the test procedure to save time. The correct answer is option A. Following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Skipping required controls undermines result reliability. Expired strips may produce inaccurate results even if they look acceptable. Modifying the procedure can invalidate the test category and results. Question 74. Before performing a fingerstick glucose test, which step supports accurate point-of-care results in the occupational health clinic during a practice drill? Option A. Skip patient identification because the device stores results. Option B. Confirm test strip expiration and run required quality control according to policy. Option C. Apply disinfectant and test before the site dries. Option D. Use a strip from an unlabeled loose container. The correct answer is option B. Confirm test strip expiration and run required quality control according to policy. Expiration checks and QC help ensure the device and strips are producing reliable results. Device storage does not replace identifying the patient. Testing before the site dries can contaminate or dilute the sample. Loose unlabeled strips may be expired or contaminated. Question 75. Why must abnormal point-of-care results be handled according to facility policy in the blood collection station during a scenario? Option A. Only normal results belong in the medical record. Option B. The patient should interpret the result without staff involvement. Option C. Critical or unexpected results may require confirmation, documentation, or immediate notification. Option D. Abnormal results should always be erased. The correct answer is option C. Critical or unexpected results may require confirmation, documentation, or immediate notification. Policies define how to verify, document, and communicate results that may affect patient care. Both normal and abnormal results may require documentation. Patients should receive appropriate clinical guidance rather than interpreting serious results alone. Erasing abnormal results hides clinically important information. Question 76. To protect patient safety, which blood component is primarily responsible for carrying oxygen in the outpatient clinic during a competency review? Option A, platelet granules only. Option B, tube separation gel. Option C, sodium citrate in plasma. Option D, hemoglobin inside red blood cells. The correct answer is option D. Hemoglobin inside red blood cells. Hemoglobin within red blood cells binds and transports oxygen throughout the body. Platelets help hemostasis but do not primarily transport oxygen. Separation gel is part of a tube system, not a blood component. Sodium citrate is a tube additive, not an oxygen carrier. Question 77. After reviewing the order, which blood component is most directly involved in forming the initial platelet plug in the hospital unit during morning rounds during a final review? Option A, platelets. Option B, glucose molecules. Option C, chloride ions. Option D, albumin only. The correct answer is option A. Platelets. Platelets adhere and aggregate at injury sites to begin primary hemostasis. Glucose is an energy source, not a clotting cell fragment. Chloride is an electrolyte and does not form platelet plugs. Albumin helps maintain oncotic pressure and transport substances but is not the platelet plug. Question 78. When preparing for collection, which vessel type is normally used for routine venipuncture in the urgent care laboratory during a study session? Option A, lymphatic duct. Option B, vein. Option C, tendon sheath. Option D, artery. The correct answer is option B. Vein. Veins are lower pressure vessels that are routinely accessed for diagnostic blood collection. Lymphatic ducts do not provide venous blood specimens. A tendon sheath is not a blood vessel and must be avoided. Arterial puncture is a different procedure and not routine venipuncture. Question 79. Why is the basilic vein approached with extra caution in the pediatric clinic during a structured exam prep drill? Option A. It always has a built-in tourniquet. Option B. It cannot be palpated in any patient. Option C. It lies near nerves and arteries in the antecubital area. Option D. It contains no venous blood. The correct answer is option C. It lies near nerves and arteries in the antecubital area. The basilic area has nearby structures that increase the consequence of poor needle placement. No vein has a built-in tourniquet. The vein may be palpable, but caution is still needed because of anatomy. The basilic vein does contain venous blood. Question 80. Before proceeding with the draw, which term describes stopping bleeding after vessel injury in the long-term care unit during a clinical simulation? Option A, glycolysis. Option B, hemoconcentration. Option C, hemolysis. Option D, hemostasis. The correct answer is option D. Hemostasis. Hemostasis is the process that stops bleeding through vascular response, platelets, and coagulation. Glycolysis is glucose metabolism by cells. Hemoconcentration is increased concentration of blood components from fluid shifts. Hemolysis is red cell rupture. Question 81. A clotted lavender tube is received for CBC testing. Why is recollection usually needed in the mobile collection site during a review? Option A, clots trap cells and make cell counts unreliable. Option B, clots improve automated CBC accuracy. Option C, lavender tubes are supposed to clot before testing. Option D, clotting proves the patient was fasting. The correct answer is option A. Clots trap cells and make cell counts unreliable. CBC testing requires a well-mixed anticoagulated specimen so cells remain evenly suspended. Clots can block analyzers or distort cell counts. Lavender tubes contain EDTA and should not clot when properly mixed and filled. Fasting status is unrelated to clot formation in an EDTA tube. Question 82. An underfilled light blue tube arrives for patient testing. What is the main concern in the emergency department bay during a mock exam? Option A. The tube will automatically refill in the lab. Option B. Excess citrate relative to blood may alter coagulation results. Option C. The patient's identity becomes verified. Option D. The specimen will become a blood culture. The correct answer is option B. Excess citrate relative to blood may alter coagulation results. Underfilling changes the anticoagulant to blood ratio and can make coagulation results inaccurate. Tubes do not refill after collection. Fill volume has no role in verifying identity. A citrate tube cannot become a blood culture bottle. Question 83. For a bilirubin collection, which additive can falsely increase potassium if carried into a chemistry tube? Option A. Sodium fluoride without potassium. Option B. Sterile culture broth only. Option C. Potassium EDTA. Option D. Clot activator gel only. The correct answer is option C. Potassium EDTA. Potassium EDTA carryover can contaminate chemistry specimens and falsely elevate potassium while lowering calcium. Sodium fluoride is associated with glucose preservation, not potassium EDTA effects. Culture broth is used for organism recovery and is not the classic potassium carryover problem. Gel itself does not add potassium in the same way EDTA contamination does. Question 84. To protect patient safety, which tube should generally be collected before a lavender EDTA tube and venipuncture order in the community health screening event during a practice drill? Option A. Another lavender tube for every test. Option B. No tube because EDTA always comes first. Option C. Gray fluoride tube after lavender only. Option D. Green heparin tube. The correct answer is option D. Green heparin tube. In the standard sequence, heparin tubes are collected before EDTA tubes to limit additive carryover effects. Collecting another lavender tube does not answer the order requirement. EDTA does not always come first and can interfere with later tests. Gray tubes generally follow EDTA, not precede it as the key before lavender tube. Question 85. If a timed specimen is collected late, which action is most appropriate in the preoperative testing area during a scenario? Option A. Document the actual collection time and notify the appropriate person according to policy. Option B. Discard the requisition without telling anyone. Option C. Change the patient's medication schedule independently. Option D. Write the scheduled time on the label anyway. The correct answer is option A. Document the actual collection time and notify the appropriate person according to policy. Actual collection time is necessary to interpret timed results and decide whether recollection is needed. Discarding the order without communication disrupts care. Medication timing decisions are outside routine phlebotomy authority. Writing the scheduled time is inaccurate documentation. Question 86. When preparing for collection, which action increases the chance of blood culture contamination in the oncology infusion center during a competency review? Option A. Using sterile culture bottles. Option B. Replicating the cleansed site with an unclean glove before needle insertion. Option C. Collecting cultures before other tubes. Option D. Allowing antiseptic to dry. The correct answer is option B. Replicating the cleansed site with an unclean glove before needle insertion. Touching the disinfected site with an unclean glove can reintroduce skin organisms. Sterile bottles help maintain specimen integrity. Collecting cultures first helps reduce contamination from other tubes. Allowing antiseptic to dry supports effective skin preparation. Question 87. In a routine phlebotomy scenario, which behavior is outside appropriate phlebotomy scope in a routine collection setting in the dialysis adjacent clinic during a final review? Option A. Labeling the specimen at the bedside. Option B. Reporting a specimen problem to the supervisor. Option C. Interpreting the diagnosis and changing the provider's order independently. Option D. Verifying patient identity. The correct answer is option C. Interpreting the diagnosis and changing the provider's order independently. Phlebotomists collect and handle specimens but do not independently diagnose or alter provider orders. Bedside labeling is expected practice. Reporting problems supports patient safety and quality assurance. Identity verification is a core phlebotomy responsibility. Question 88. A patient asks when results will be ready. Which response is most appropriate in the student skills lab during a study session? Option A: promise exact results in 5 minutes for every test. Option B: tell the patient results are not their concern. Option C: guess a diagnosis from the tube color. Option D: explain that the laboratory or provider will report results according to facility process. The correct answer is option D. Explain that the laboratory or provider will report results according to facility process. The phlebotomist can provide general process information without interpreting or promising results outside their role. Turnaround time varies by test and setting, so a universal promise is unsafe. Dismissive language is unprofessional and does not support patient-centered care. Tube color does not allow diagnosis. Question 89. During a structured exam prep drill, which disposal choice is correct for blood-soaked gauze after a draw in the occupational health clinic during a structured exam prep drill? Option A: place it in the appropriate biohazard waste container according to policy. Option B: put it in a clean supply drawer. Option C: hand it to the next patient to hold. Option D: place it in the sharps container. The correct answer is option A. Place it in the appropriate biohazard waste container according to policy. Blood-contaminated soft waste belongs in the designated biohazard stream when required by policy. A supply drawer must remain clean and uncontaminated. Giving contaminated gauze to another patient creates exposure risk. Sharps containers are reserved for needles and other sharps, not soft gauze. Question 90. In the blood collection station, which item should never be stored with clean blood collection supplies? Option A: unexpired evacuated tubes. Option B: used needles or blood-contaminated materials. Option C: clean tourniquets ready for use. Option D: unopened sterile needles. The correct answer is option B. Used needles or blood-contaminated materials. Clean supplies must be protected from contamination to prevent patient exposure and specimen problems. Unexpired tubes belong with clean collection inventory. Clean tourniquets can be stored for patient use if facility policy permits. Unopened sterile needles are appropriate clean supplies when stored correctly. Question 91. Why should a phlebotomist follow the facility procedure manual rather than personal shortcuts in the outpatient clinic during a review? Option A: procedure manuals are only for new employees. Option B: regulations do not apply to outpatient settings. Option C: standard procedures support consistent safety, quality, and regulatory compliance. Option D: shortcuts are always faster and safer. The correct answer is option C. Standard procedures support consistent safety, quality, and regulatory compliance. Written procedures create a consistent standard that reduces variation and errors. Experienced staff are also expected to follow current procedures. Regulatory and safety expectations apply across collection settings. Shortcuts can bypass safety checks and increase risk. Question 92. To protect patient safety, which action helps prevent leakage during specimen transport in the hospital unit during morning rounds during a mock exam? Option A: carry open tubes by hand. Option B: place tubes loose in a coat pocket. Option C: loosen the stopper to release pressure. Option D: ensure the tube is closed securely and placed in approved transport packaging. The correct answer is option D. Ensure the tube is closed securely and placed in approved transport packaging. Secure closure and proper packaging protects staff, couriers, and specimen integrity. Open tubes increase spill and contamination risk. A coat pocket is not approved specimen transport packaging. Loosening the stopper can cause leaks and exposure. Question 93. A serum tube and lavender tube are ordered after blood cultures and citrate, which should be collected first in the urgent care laboratory during a skills check. Option A, serum tube before lavender tube. Option B, gray before both in every case. Option C, order does not matter if both are mixed. Option D, lavender before serum. The correct answer is option A. Serum tube before lavender tube. Serum tubes are collected before EDTA tubes to reduce EDTA carryover into chemistry specimens. Gray tubes are generally later in the order and are not automatically before serum. Mixing tubes does not correct additive carryover. Lavender first can contaminate the serum tube with EDTA. Question 94. When preparing for collection, which tube is most associated with ESR testing in many phlebotomy settings in the pediatric clinic during a practice drill? Option A, gray fluoride tube for every ESR. Option B, lavender EDTA tube or designated black citrate tube depending on method. Option C, SST for all ESR methods. Option D, blood culture bottle only. The correct answer is option B. Lavender EDTA tube or designated black citrate tube depending on method. ESR collection depends on the facility method, commonly EDTA or a designated citrate ESR tube. Gray fluoride tubes are not the usual universal ESR container. SST serum is not appropriate for all ESR methods because ESR evaluates cellular settling. Blood culture bottles are for microbiology cultures. Question 95. Why should serum tubes be allowed to clot before centrifugation unless policy states otherwise in the long-term care unit during a scenario? Option A. Early centrifugation improves blood culture growth. Option B, serum tubes contain no blood cells. Option C, centrifuging too early can leave fibrin strands and compromise serum quality. Option D, clotting makes EDTA work faster. The correct answer is option C. Centrifuging too early can leave fibrin strands and compromise serum quality. Serum specimens need adequate clot formation so serum separates cleanly after centrifugation. Blood culture growth is unrelated to serum tube clotting. Serum tubes initially contain whole blood cells before clotting and separation. EDTA is not the additive in a serum tube. Question 96. Before proceeding with the draw, which tube should not be centrifuged before it has clotted when serum is required in the mobile collection site during a competency review? Option A, light blue citrate tube for patient. Option B, gray fluoride tube for glucose. Option C, lavender EDTA tube for CBC. Option D, red top or serum separator tube. The correct answer is option D. Red top or serum separator tube. Serum tubes must clot before centrifugation to obtain clear serum and avoid fibrin problems. Light blue specimens are anticoagulated plasma for coagulation testing. Gray specimens contain additives for glucose preservation and are not serum clot tubes. Lavender CBC specimens are whole blood and are not clotted for serum. Question 97. During a final review, which action is appropriate if a patient has a latex allergy in the emergency department bay during a final review? Option A, use latex-free equipment and follow facility allergy precautions. Option B, ignore the allergy if gloves are powder-free. Option C, ask the patient to hold the latex tourniquet away from the skin. Option D, use latex equipment briefly because exposure is short. The correct answer is option A. Use latex-free equipment and follow facility allergy precautions. Latex-sensitive patients require latex-free supplies to prevent allergic reactions. Powder-free latex may still contain latex proteins. Having the patient hold latex does not remove exposure risk. Short exposure can still trigger a reaction. Question 98. In the physician office lab, which mismatch requires resolution before drawing blood? Option A. The collection tray has extra gauze. Option B. The requisition name does not match the patient's wristband. Option C. The phlebotomist has 2 tube holders. Option D. The patient is wearing a sweater. The correct answer is option B. The requisition name does not match the patient's wristband. An identity mismatch can lead to a wrong patient specimen and must be corrected before collection. Extra gauze does not affect patient identity. Having additional clean equipment does not create a patient mismatch. Clothing choice does not create an identification conflict. Question 99. During downtime when barcode labels are unavailable, what should guide specimen labeling in the community health screening event during a structured exam prep drill? Option A. Labels borrowed from another patient. Option B. Memory of the patient after the shift. Option C. Approved manual identification and labeling procedure. Option D. No labels until the computer returns. The correct answer is option C. Approved manual identification and labeling procedure. Downtime procedures are designed to maintain traceability when electronic systems are unavailable. Borrowed labels cause wrong patient errors. Memory after the shift is not a reliable labeling method. Unlabeled specimens are unsafe and may be rejected. Question 100. To protect patient safety, which action reduces sharp's injury risk immediately after withdrawing the needle? Option A. Set the exposed needle on the bed. Option B. Hand the exposed needle to a coworker. Option C. Carry the exposed needle to the lab. Option D. Activate the safety feature as designed and dispose of the device promptly. The correct answer is option D. Activate the safety feature as designed and dispose of the device promptly. Safety activation and prompt disposal isolate the sharp before it injures someone. A bed is not a safe surface for a contaminated sharp. Passing an exposed needle puts the coworker at risk. Carrying an exposed needle increases injury risk during transport.